When an individual completes SSP and they see, large or gains in social behavior or auditory processing, often parents and therapists would say, "Can I do this again? Let's see what happens," or will it be maintained? The actual model has a structure to it. It really says the development of the effects, the progression of the effects following SSP, the big ones are not immediate because they require the interactions with the context, with the environment. And if the environment is as welcoming as the child's spontaneous engagements are, the system will be more actively retuned and greater progress will occur in terms of things like state regulation, social behavior, even language. So from my experience, the effects have always, or let's say usually, been greater 1 month after, and they tend to continue unless there's a disruption. Now, what do I mean by disruption? I mean, does a child have a fever, get sick? Is there retraction of the system? And the retraction can be due to illness, and it could be due to, let's say, a disruptive event, a severe disruptive event, whether it's something that is literally traumatic in the home, or it could be something in the classroom. So the question is, how can you then retune the child? My preference is that you don't repeat it until a 3-month window to allow the system to restabilize and to become itself. And then in 3 months, you can see what happens. What I noticed in the past, and I did this in a few participants, I actually did repeat it once or twice a year. And for several years, you could see incremental changes. And so it wasn't like you're duplicating the same thing. It was like once they did it, it was like pushing them forward another step. Okay. So my recommendation is that you do it in 3 months. But I also want the clients, meaning in this case the therapists, to monitor the child and to see if there is a loss of function. So a stability of function is fine. An improvement of function is even better. But if you start seeing a loss of function, start asking different level questions. Start saying, was the child ill? Was there something going on in the family? Because if the system gets recruited, it will start progressing unless there is a disruptor. And that you should start finding out. And then you can redo it in 3 months and see where it goes. But 3-month intervals would be the shortest that I would recommend. But I would also emphasize, pay attention to what's happening to the child in the child's context. The time frame of repeating the SSP requires a different metaphor. We're so used to thinking of interventions as being time limited because we have medical models. We think of pharmaceuticals, we think of injections, inoculations, and the system, in a sense, takes it in for a while and then it wears out. SSP is different. SSP is based upon a principle of a neural exercise where the system becomes more fluid, more flexible, and basically gets more optimal. If there is a loss of function, it's telling you that the system has been disrupted, and that becomes a strong trigger to engage the family, use the SSP. So I would do 2 things. One, basically think about it as at 3-month intervals, but always monitor the family and the child and see what's happening. And if there's constant progression, then your world's just great. With the SSP, there are questions about repeating the protocol. And we have certain basic principles of it shouldn't be repeated within 3 months. However, once an individual has completed the protocol, then the cues from the SSP may be useful as portals to trigger state changes that will be facilitators of other therapeutic models or therapeutic treatments. So it may be that you're working with clients who have gone through the SSP and they come in and they have a state of agitation or not really or uncertainty, and you allow them to listen And I would suggest they would listen to day 5 or 5B at the end. Listen to, between 5 and 10 minutes, because those cues should enable them to calm down and feel more resilient. And you can use that as that opening portal or as a state regulator for your clients, but not as a treatment. It's not saying that those 5 or 10 minutes is a treatment. It's really a cue that that individual is now back in a safe place.